All right, let's call to order the Board of Franklin County Commissioners meeting for January 13th.
Commissioner Stottlemyre?
Present.
Commissioner Harris? Chair Waymeyer?
Present.
Vice Chair Dickinson?
Present.
Commissioner Dunn?
Present.
All right, if you'd all join me for the Pledge of Allegiance. I pledge allegiance to the flag
To the flag of the United States of America,
and to the
to
republic
the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All righty. And today we have invocation led by Pastor Mark Hutton. Are you on, sir?
Yes, sir, I am.
All right, it's all yours. Go for it.
All right. Good morning, everybody, distinguished commissioners. Let us pray. God, as we greet this new day, we give you thanks for the rising of the sun, for the beauty of the earth that surrounds us, for the reality that life lives within us, for the breath that you have placed within our bodies that gives us life. God, we give you thanks and praise. God, for this day, we ask for your guidance. For our distinguished commissioners who lead us, I pray that they will discern your will as they lead our county. God, I pray a blessing upon each and every one of them, upon our county leaders, those who serve us so well. I pray a blessing upon their homes and their families who share their loved ones with us. For the business at hand, God, I pray that the minds that make the decision will have a spirit of servitude, will remember that they are called to serve the people, and that they will keep that in mind. And God, as we are in the midst of transition within our country, I pray for our country, for the division that we see. I pray for unity, for the hatred, for the chaos. I pray for peace and calm. God, may we come together as a nation, united under you, just as we said in our pledge. And God, may we, in our little corner here in Kansas, in Franklin County, may we lead by example, showing that even though there may be different ideas, we are willing to listen to one another and to lead with unity and in humility. So God, that we pray this, and we ask this in your Son's name, giving thanks and praise to you. Amen.
All right, thank you, sir.
Thank you.
All right, let's go to the correspondence and organizational business. Derek?
I don't have correspondence or organizational business, but I would just let Janet know that Commissioner Harris is on this call. So he had just stepped away from his phone momentarily. So he is here. Thank you.
Good deal. Any public comment?
None at this time.
All right. Our consent agenda today would include minutes from our January 6th meeting, our study session on the 11th, our reorganization meeting on the 11th, claim vouchers in the amount of $288,617.51, and tax change orders in the amount of a negative $330.96. Our motion to approve the consent agenda.
Mr. Dunn, motion to approve the consent agenda.
Is there a second?
Commissioner Dickinson, I'll second it.
Ready?
Commissioner Stottlemyre, how do you vote?
Yes.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Chair Waymeyer?
Yes. Down to items of business, first of which is to consider Approving revised pay structure for AEMT and paramedic positions to be more competitive with the market. Nick, are you on?
Good morning, Commission. This is Nick. Thank you for having me on this morning. I want to kind of just give a quick overview of our discussion from the study session and then entertain any questions that you guys have. So the background behind what we're talking about is the paramedic salaries have increased in surrounding communities to a point where Franklin County is no longer competitive to really bring in paramedics to this area. We have looked at other options before we came to this by, looking at some different schedule options. We've done recruiting at the colleges, and due to the shortage in the locations that we're at, it made it difficult for us to compete. So the next step we took was a pay plan study, and looking at the counties surrounding us and knowing very well that we couldn't compete with the Johnson counties and the Douglas County pay study, we found that we were not competitive in counties similar to our size. With that, we put together what I feel is a very good pay structure, and essentially bringing the paramedic wages up to a competitive spot. And that's essentially just a little bit over $1 an hour. With that, we will need to make adjustments to the captain to pay to work on the compression, so we still have some differences between that. The other thing that we did look at when we were doing this is our AEMTs, and the AEMTs is an advanced EMT. It's a midline between an EMT and a paramedic. They do have the ability to do certain skills that are advanced over the EMT, but we also have the ability to train those in-house. And we have trained the majority of them that way. So with that, we looked at the surrounding counties as well, and a lot of them didn't have a pay structure for an AEMT. That was normally a percentage bump within their EMT schedule. And when we looked at that, we found that we were very much over the market in that. So what we've decided to do with that is to drop that pay down essentially $1 an hour for all new AEMTs that would be starting. We have AEMTs in a class right now that we've already pretty much talked about the existing pay plan, and they'll be grandfathered in and stay in that plan. But in the future, any AEMTs we hire will fall into the new AEMT structure. And as we talked about through some salaries that we've been able to get reimbursed for, we can easily fund this and get through the 21 budget and make the changes that are necessary. With that being said, I'm open to any questions that you might have.
All right, we talked all about this Monday.
Yeah, this is Commissioner Dickinson. After I had thought about it on Monday, I really truly don't have a problem with raising the salaries, but I have more of a problem with reducing salaries over to a certain level, especially in a first response position in the middle of a pandemic. It doesn't seem to make a lot of sense. I would personally be ready to just leave what we had and then raise the other one, but it's really up to the commission.
Okay. Is there any appetite to look at that, or would the majority prefer to go with what's in front of us? What are thoughts?
Well, Colt, this is Derek. I would just add, and I believe Commissioner Dickinson knows this, and she feels this way despite that, which is completely okay. But I do want to make it crystal clear that nobody that is currently on board is going to suffer a pay decrease. Even the EMTs who haven't went through that certification process, if they are on board, they are going to get paid the same. I mean, this is about being, competitive and accurate with the market. And so bringing our AEMT pay back down, I mean, it doesn't make us less competitive per se. I mean, we're one of the few organizations that offer that premium. And so, I mean, certainly if we do this and we find that we're now struggling to get EMTs, then we could look at switching something back. But I've asked Nick that question 100 different ways, and he assures me that this isn't going to lead to any trouble getting EMTs, that getting EMTs is not a problem whatsoever. So the people we currently have will not be hurt with it at all. This is just about helping us with the budget on the backside. Having said that, if IAN understands that and still feels the same way, then certainly that's a valid position. I just want to make sure that that's clear to the rest of the commissioners. Thank you.
This Commissioner Dunn, for Nick, a lot of organizations don't have an AEMT designation. How do these people get recognized if they do leave our county and go somewhere else and say they are AEMTs and not just EMTs? Should we stay with that designation? She said a lot of them don't have that designation.
Let me walk through that real quick. Thank you for that question. One of the things that we have is the state of Kansas has essentially 4 different certifications. They have an EMR, which is the Emergency Medical Responder, and that a few years ago replaced the First Responder certification. Then they have the EMT, which is your basic level BLS provider that can work on an ambulance. And then they have the Advanced EMT certification through the state, and what that allows is they're allowed to push certain medications. They're allowed to interpret EKGs and do more advanced skills than an EMT, but not the advanced skills of a paramedic. And one of the things with paramedics, and we've seen it with the pandemic, is intubated patients or advanced medications for sedation, cardiac meds. AEMT cannot do that. And with that, it's essential for this service to have paramedics. To answer your question, the state of Kansas is certifying them as AEMTs. We are just one of the few services that distinguish between an AEMT and an EMT. When the AEMT was put into place by the state of Kansas, it replaced the EMTI, which was an intermediate, which basically allows for IVs and certain things. It just standardized us with the rest of the United States, basically, so we could get reciprocity when we were bringing people in and out. So with that, we're not taking away their AEMT. We will still have a designation between an EMT and an AEMT, where if you look at, say, Miami County, if you're an AEMT, you still fall into their classification of an EMT, but they may start you out at 6% higher than a baseline EMT to pay you for the difference versus having, like we do, a EMT, AEMT, and then paramedic pay structure. That it falls within those. And that's how a lot of the services do that. To talk a little bit more about the AEMT, we hire EMTs the majority of the time. When the AEMT curriculum came out, it was a very rough curriculum, and honestly, some of the instructors that taught that didn't do a good job on what we had. So we chose to train them in-house. So the EMTs that we're hiring are getting their education paid for, and then getting even with dropping it back $1 an hour, a significant raise for education that we're providing, and honestly very competitive with still at that $1 or less. So we're not by no means hurting. I will also tell you that I've talked to 2 crews about this, because after the study session, I wanted to get ahead of anything that could be talked about without my hearing it from me. And I had none of my crews, even the EMTs, have any problems with it. I talked to the EMT classes currently in class, and they understood that if they pass this class, they will be at the old rate. But if any of them do not pass that, they would fall back, and none of them had any qualms about that, and my department seemed very supportive of it. Thank you.
Yes, Commissioner Dunn, that answers my question, Nick. I didn't know there was a state certification for that. That answers my question.
All right. Well, our management is, recommending that we take those resources that we're currently putting towards AMT and then put it towards our starting salary so we can be more competitive and attract folks to this organization. So I guess we'll throw that motion out there first. If anybody would like to make it, it'd be a motion to approve revising the pay structure for AE, MT, and paramedic positions and adjusting the captain's pay per staff recommendations.
This is Commissioner Dunn. I'll make a motion to approve this pay adjustment.
Commissioner Harris will second it.
Commissioner Harris, how do you vote?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Chair Waymeyer?
All right. Now to our second item of business, which would be considered for approval of various annual software maintenance renewal invoices. Dustin, are you on?
Yes, good morning, Commissioners. So what we have here is 4 different invoices from a variety of vendors that we deal with. The first one being Thomson Reuters, or Amentum now. That's for our financial management, payroll, some of our online GIS or land records, that sort of function, motor vehicles. The other large one in this bundle is Tyler Technologies, which is used for our public safety software, including CAD, mobile CAD, records management for those. The mobile wireless invoice is our NetMotion VPN licenses. That is also for the first responders for all their mobile units to securely connect back to us. And then the Civic Plus invoice is human resources modules for employee onboarding and applicant tracking. Total of these invoices is $113,921.15. It is an annual invoice that comes due in January. Each of these are annual invoices that come due in January each year.
All right. Any questions?
This is Commissioner Dickinson. How does it compare yearly? Does it stay pretty even, or does it go up a lot? Or?
It's fairly level. There was slight increases. I don't have a percentage in front of me on that, but they were all slight increases. I believe last year's across the 4 was a few $1,000s less. I believe it was 108 or 109,000 last year.
And of course, nothing goes down. So.
Correct.
All right. Well, it's expensive, it's necessary, and something we do every year. So, a motion to approve this item would be to approve payment for invoices for annual support services for the fiscal year of 2021 in the amount of $113,921.15. Anybody care to make that motion?
Commissioner Dickinson, I'll make that motion.
Mr. Dunn, second.
Commissioner Dickinson, how do you vote?
Yes.
Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Harris?
Yes.
Chair Waymeyer?
Yes. And our third item of business. Thank you, Dustin. Third item would be to consider nominating Pat Campbell to serve as the noxious weed supervisor. David Lee, Public Works Director, should be on.
Good morning, Commissioners.
Morning.
This is an item that the Kansas Department of Agriculture, they require each county to have a county weed supervisor appointed. And staff would like to appoint Pat Campbell. Pat has all the required certifications and certainly has the experience necessary to fulfill this role. And we would ask for a motion and approval to have Pat serve in that capacity.
All right. Didn't Pat do this last year or previously?
I believe that A.J. Watts was the previous weed supervisor. A.J. has transferred over to the Road and Bridge division, and Pat, we probably should have done this last year, but one of those items that we just didn't get done, so we're correcting that now.
All right. Who would like to make a motion nominating Pat Campbell to serve as noxious weed supervisor?
This is Commissioner Dunn. I'll make a motion to approve Pat Campbell be our weed supervisor.
All right.
Commissioner Dickinson, I'll second it.
Commissioner Dunn, how do you vote?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes.
Chair Waymire?
Yes. All right, down to our fourth item, which would be to consider approving a proposal from Cook Platte Strobel Engineers to perform a biennial bridge inspections on behalf of Franklin County.
Okay, Commissioners, this is something that we do every other year on the odd years, where we have all of our bridges in the county inspected. CFS Engineers, Cook Platte and Strobel, has done this service for us for many, many years, and they do a great job for us. This year, their proposal is for the cost of $95 per bridge, for a total of $22,420 to inspect the 236 bridges on this particular list this year. I will say that a few months ago, KDOT provided 7 additional bridges to us. All these bridges were associated with the new Highway 59 project. It's not new anymore, but KDOT has been monitoring those since the project was completed, and they just got around to transferring those to us within the last several months. These bridges were inspected by KDOT last year, so instead of including those in this batch of bridges for this year, we'll just slip those into the fracture critical bridge inspections that occur on the even years. So next year, instead of just having a few, 2 or 3 of the fracture criticals, we'll also do these 7 additional bridges at that time. So staff would like to move forward with this so that we can get CFS on board and get those inspections done in a timely manner.
All right. The motion to approve would be to approve the proposal from CFS Engineers in the amount of $22,420 to perform a biennial bridge inspection on Franklin County bridges. Need a motion.
Commissioner Dickinson, I'll make that motion.
Commissioner Dunn, second.
Commissioner Stottlemyre, how do you vote?
Yes.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yep.
Chair Waymire?
Yes. Fifth item of business is a special maintenance agreement with the Kansas Department of Transportation to consider. David?
Okay, so this agreement that you have before you has been prepared by by KDOT, and this really just formalizes an arrangement we have on multiple flyover bridges throughout the county. In this, it depicts what each entity's responsibility is related to maintenance and improvements in these areas that are delineated on the attached aerial. But essentially, it just says that we're going to work together to take care of these things, which we are already doing. We just don't have a formal agreement, to my knowledge, on the other structures, the other bridges that connect our local roads. This is for the new Montana Road Bridge over I-35, which connects Montana Road and Labette Road. I spoke with the contractor and the inspector just last week, and this project should be completed within the next 2 weeks. So that will be open and available for our citizens to use. But in the meantime, we would like to go ahead and approve this special maintenance agreement with KDOT.
Any questions for David? The motion in the affirmative would be to approve a special maintenance agreement with KDOT related to maintenance of Labette Road and Montana Road adjacent to the new Montana Road Bridge over I-35.
Mr. Harris, so move.
Thank you. Is there a second?
Commissioner Dickinson, I'll second it.
Commissioner Harris, how do you vote?
Yes.
Commissioner Dickinson?
Yes.
Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Chair Waymeyer?
Yes. All right. Our sixth item of business, we would consider holding a public hearing to consider vacating 2100 to 2300 Stafford Terrace from the east right-of-way of Kentucky Road to the west right-of-way of Louisiana Road, and consider a resolution regarding the road vacation. David, you want to go ahead and talk about this before we open the public hearing?
Yes, sir. So we discussed this project a few weeks ago. All of the landowners along Stafford Terrace that are adjacent to that road, each one of them signed the petition asking the county to vacate that right of way. This is another area where we have trouble with people that do a lot of four-wheeling and ATVs and that sort of thing down this minimum maintenance road whenever it is wet or snowy or the least bit muddy, which really inhibits the landowner's ability to get into their fields when necessary to check cattle or to work in their fields. And so the landowners requested that we vacate this right of way so that they can gate this off to prevent folks from destroying or causing hardships on them during these times. So what we need to do is to open a public hearing to allow for public comment related to this. And then once that public hearing is closed, we would ask that you approve a resolution vacating this right of way.
All right, thank you, David. Would anyone care to make a motion to open the public hearing to consider vacating this portion of road?
Yes, Commissioner Dunn, I'll make a motion to open a public hearing to vacate that road.
Is there a second?
Commissioner Dickinson, I'll second it.
I don't know if they heard you, I am.
Commissioner Dickinson, I'll second it.
Chair Waymeyer, this is Janet. Would you like me to call the roll?
Yeah, sure.
Commissioner Dickinson, how do you vote?
Yes.
Commissioner Dunn?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Harris?
Yes.
Chair Waymire.
Yes. All right, do we have any public comment, Janet?
I do not see anyone on the meeting unless they're sharing a microphone with another member of our staff.
Okay. Anybody care to speak on this?
Yeah, this is Commissioner Dunn. This is in my district. I'm very familiar with this section of road, and I know it gets tore up every time it's muddy or rain or snow. Very familiar with that situation, and I would recommend that it be closed.
All right. Just make sure we don't have any public comment. I'll ask one more time.
I do not see anyone.
All right. Well, and we would need to close our public hearing.
Mr. Dunn, I make a motion to close the public hearing.
Commissioner Dickinson, I'll second it.
All in favor of closing the public hearing, let's just say aye.
Aye.
All right.
All right.
Any opposed? All right, then. So then we would need a motion to, let me pull this up on my agenda so I say it exactly. Oh, I don't see the proposed. We need a motion to,
Commissioner Dickinson, I'll make a motion to vacate that Stafford Terrace from the east right-of-way of Kentucky Road to the west right-of-way of Louisiana Road.
all right. Is there a second for that?
Commissioner Dunn, I'll second it.
Commissioner Dunn, how do you vote?
Yes.
Commissioner Stottlemyre?
Yes.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes?
Chair Waymire.
Yes. All right, down to our seventh item of business, which is consider a resolution adopting the updated Lake Region Solid Waste Management Plan as required by state statute.
Okay, Commissioners, the Management Committee within the Lake Region Solid Waste Group has reviewed this document. Each year, we're required to provide updates and resubmit that to the state. Staff has gone through this, and we have updated contact information. We added our new logo and added just a little bit additional information related to new construction in the county that's happened within the last few years. But other than that, the plan remains as is. I think each of the 6 counties went through a similar process, and we are required to adopt a resolution approving this revised plan, and we would ask for an affirmative vote to do so.
All right, pretty straightforward. Any questions for David?
No questions. This is Commissioner Stottlemyre. I do serve as a this. Shay, as our coordinator, did a great job. I've looked it all over several times, and it's very accurate, very thorough, and I think we ought to be proud of it. That's it.
And Commissioner Waymire, I will include, as I noted on the cover sheet, this plan was, the last major revision was done in 2018. We will have another minor update next year, and then in 2023, we will do a major revision where we will go through this and really do a thorough update at that point. So you'll be seeing this again each year from now on.
All right. Anyone care to make a motion to approve a resolution adopting the revised Lake Region Solid Waste Management Plan dated December 2020?
This is Don. I'll make the motion.
Mr. Dunn, second.
Commissioner Stottlemyre, how do you vote?
Yes.
Commissioner Harris?
Yes.
Commissioner Dickinson?
Yes?
Commissioner Dunn?
Yes.
Chair Waymeyer?
Yes. Now to staff reports. Derek?
All right, thanks, Colt. Couple of things. One, the furniture for the remodel came in yesterday. And so I know Brandon has been working very hard trying to get that sorted and set up. I was over there last night, and it looks like he has done an excellent job. So certainly appreciate that. Now, I've said this for weeks, but this is still very much a work in progress and is going to be for some time. You know, we have a beautiful space, and now we have some office furniture. But, you know, there are common areas that will need to be looked at and furnished, and there's nothing on the walls, obviously. And so it'll be a little while before it's a finished product, but it's certainly well on its way. In terms of moving in there, I don't think that every staff member who has an office is going to do that immediately. I think that I would expect that, to just happen over the next few weeks. I do think HR is anxious and will probably get over there ASAP. And so, but, I'll give you updates on how that's going. In terms of COVID, obviously we continue our COVID response. I'll let Nick talk a little bit more about this, but obviously, as we have discussed, we received 500 vaccine doses from the Health Partnership Clinic, and that is basically 250 first doses and 250 second doses. And so we're still in phase 1. The state hasn't given us authorization to move on to stage 2 of that. But that's fine because we have enough healthcare providers here in this community that between, county employees who are part of the COVID response, and then those kind of on the front lines, as well as other healthcare providers, we're not going to have any problems using those 250 first and second doses. So the health department continues to work on that. The other thing I want to bring up, just because this is something that's been discussed throughout this pandemic, and it's something that I've heard recently. I want to talk about COVID bonuses, or this concept of paying employees more in response to this pandemic. This is something that listservs have been discussing at length for months. I will tell you, some communities have used some CARES Act money to pay, certain bonuses for COVID response. I will tell you, I have been against that and remain against that from the beginning, and I'll tell you why. For one, all of our hourly employees who are working overtime, they are getting paid time and a half. So obviously they're getting a generous bonus on any time they work above and beyond their 40 hours. Our employees in the health department, I cannot tell you how great they have been. They have done an exceptional job. But for a lot of them, their core duties haven't really changed. And so, there's some added stress during a pandemic, but they're answering phone calls, they're recording information, and to the extent they're working above 40, they are getting paid overtime for that. And I think where the county is really benefiting, as I think about the group of salaried employees. I think about some of the hours that Nick Robbins has put in, the hours that Janet Paddock has put in, that Casey Brady has put in, Christy Hilliker. obviously those employees I'm not giving bonuses based on that, but here's the thing. I am of the mindset that leaders do more, and leaders do more without expecting extra compensation in return for that. You think back to last year and what a crazy year that was for Public Works. All of the storms, we had storm after storm after storm. David Lee didn't ask for a bonus based on that. Jeff Welton didn't ask for a bonus. And I think there was an understanding there that sometimes you have to do more. And in that same vein, I think about all the hours that Janet has into this CARES Act reporting stuff. She's never asked for a thing. Casey's job has basically, it's entirely different now. Hasn't asked for a thing. I think about all the technology changes that we've went through. Dustin hasn't asked for a thing. And that's why they're in those positions. That's what makes a good leader, is that they don't expect more. And so I want you to know as a board where I am at on that. I think the reward is, and hopefully they've earned it from the 5 of you. They certainly have from me. And the reward is the respect that gets earned. I will never forget the extraordinary efforts that we've seen throughout this pandemic. And I hope that the 5 of you commissioners won't either, because in all likelihood, none of us will ever manage through anything remotely as stressful as this. And if we can get through this, and I'm here to tell you we are, and we're doing a great job. If we can get through this, if this team can endure this pandemic, then this team can endure anything. And so that, to me, it's not throwing money at it. It's the respect, the camaraderie. It's the citizens understanding, hey, you've got a group of leaders that aren't expecting more when their workload kicks up. That's really where the rewards come. And so just wanted to discuss that a little bit, and can certainly answer any questions from any of you, but I'll just end that spiel with I'm really proud of our employees, and I'm proud of the fact that none of my leaders have came to me with their hand out expecting anything. They've just quietly risen to the occasion and have done an exceptional job.
I'll cut in there, Derek, because I know you won't say this about yourself, but this is also being said by you, who's routinely over the last year worked 50, 60, at least hour weeks yourself. So it's not coming from on high from somebody who himself isn't right there going blow for blow, working extra. So go ahead.
No, I appreciate that, Colt, and that's really all. Just that's been a discussion, and Lord knows, I say this all the time. We have 250 employees, give or take, and I would love to give them all the money. I really would. But we also have an obligation to be good stewards of the tax dollar, which is another thing that I think we do exceptionally well here. And so we always have to balance being fiscally responsible with taking care of our people. And I believe we do that. But in this instance, I don't think, giving out bonuses to our leaders was the right call, and I stand by that. But again, I think they've all done an exceptional job. I think all of our people have done an exceptional job. This has been a stressful event for every one of our people for a variety of reasons, and I'm pleased with where we're at. So thank you very much. That's all I have, Cole.
Commissioner Dickinson, I will echo everybody's sentiments. Unfortunately, we haven't been able to really show our appreciation to our employees because of not being able to see them in person, but definitely you've all done a great job. I do have one question on a comment that you made early on when you said we had 500 doses. I know the Department of CDC is encouraging us people not to save those doses for a second dose, but to get them all out, and get more people vaccinated, but I understand that we're not doing that.
Yeah, I will, Nick, I'll let you answer that question. I know you've worked closely with Aaron on making those decisions.
I'm sorry, I'm having trouble hearing Ian, or Commissioner Dickinson. Can you, can somebody tell me that question was, because I just had trouble hearing it.
Yeah, this is Derek. Ian she is hard to hear this meeting for whatever reason. She's basically said that the CDC is recommending that we push out all doses, that we don't hold back second doses. And I know generally that has been our approach, but with these health partnership clinic doses, we have decided to hold the 250 back. And she was just asking for insight on why that decision was made.
Okay, thank you for that clarification. Let me jump right into that then. So the Health Partnership Clinic was able to secure us, or they were able to receive, I believe, just over like 3,000 doses. But when their orders from the federal government, because they're regulated by the federal government, was to hold back 50% of those for the second dose because they didn't know if they would be getting those. The other thing is with the expiration dates of that, they wanted to make sure that they had that second dose. So they have been the ones that have informed us, and they were also the ones that gave us that we may not get the other 250. So if we would give those and not get the other doses back, we have now not been able to vaccinate the healthcare providers. But I think I'm going to share some good news with you moving on into that. But as far as the 250 that we are holding back, that is because the healthcare partnership who have signed those over to us has gave us that guidance because that's what they received from the federal government. When it comes to the doses that are given to us by the state for the health department to distribute, they are ensuring us that we can push every bit of that out because they will be at the 28 days giving us the doses we need to give that second dose. So that is the reason we are holding on to the 250. But I did just receive word today that we should be getting 300 doses of the vaccine to us today to start pushing out to what we're hoping is going to be the public. The latest phases that we have are phase 1 is healthcare workers, residents of long-term care, which we know is being taken care of by the Walgreens and CVS. And then critical pandemic workers. I will tell you, to date, we gave 150 doses. We're going to finish up with that 250 the rest of this week for the healthcare providers in the county. So at the end of this week, all healthcare providers that we've gotten the doses for will have received everything we have. The 300 doses that I have just gotten today that I'm telling you about, I am very hopeful will allow us to start vaccinating phase 2, and we should receive word on that today. So that will be persons over 65 is the next target that I'm hoping we can start working for. With that being said, I know there's a lot of people wanting that. We have 1,803 people already on the opt-in, have called the opt-in line. So 300 is going to put a small dent in that, but hopefully this is the beginning of starting to get some doses. So I guess before I move on, Ian, does that help you understand that a little bit and where we're at with the 250?
Yes, definitely, absolutely. I did have a question on, so that's also congregate settings. Does that include our jail? And also do our school teachers, is that considered a congregate setting?
school teachers are going to fall farther behind. They're behind the person the age of 65 and over. And I say this every week, and I feel like I'm a broken record, and I hate to, but our guidance is horrible. And, you know, one time you hear this, and the next time you hear this, and then you have somebody else saying that, oh, well, this is what's going on. And then today, honestly, I've been on the phone with two of our superintendents before 8 o'clock this morning asking the same questions. And the orders that the health department's received is you vaccinate all frontline medical workers, anybody that's critical to the pandemic, and healthcare workers in nursing homes. And like I said, the Walgreens and CVS did that. At that point, health departments were supposed to turn in any extra doses they had. One thing we have been able to do is we have picked up some very important individuals with doses that we have left over. Once you puncture a vial, you have 6 hours to distribute that medication. So we have had individuals that signed up. We've had medical personnel that, for some reason, upon arrival, they have been unable to receive the vaccine when they get here. So we have a list that we've distributed this to some of our essential workers that may fall into the phase 2. And it's just because we're not going to waste it, and it's hard to like have a waiting list and try to track down some of these other people. So we have been able to, with a dose here and there, get some of them, because like I said, I'm not going to waste a dose for nothing. So we have picked some of those up. Today we are supposed to get 300, and I'm excited that the state might give us the guidance to pull the trigger and start vaccinating in phase 2. And that is where we'll get, hopefully, the guidance on who's going to take priority and what's here and how we're going to do that. So the schools I know are antsy. I will tell you my guidance to the superintendents is if you have a teacher or a para or somebody over 65 that does meet the criteria, tell them to get on the list. The list is going to be the important part of us distributing this, so we can have a good idea of how many, and we can keep kicking those numbers to the state. So that was my guidance to the schools. And as we keep rolling, I'm hoping we continue to get more information on the vaccines. And I know we get tons of calls. I'm sure you guys are hearing them. I've had residents that honestly have broke my heart that they want this bad. They meet the needs, and we just don't have it yet. And hopefully this 300 doses I found out we're getting today will lead us down that path to get these other places given. I will tell you, when you start talking about the jail setting, one of the big questions we have are what about the inmates that might be in there today but won't be in there 28 days, and how are we going to track them and get the doses to them and ensure they're going to get it? And that's the question that I keep asking the state is what part of that are we going to do? Because if they're only in there for a week, given that first round vaccine may not be the most responsible way to do this if we have other needs for that. So it's kind of an interesting conversation, and I hope that we get some solid guidance soon. And like I said, I have had conversations already with two of the superintendents this morning, and everybody and is antsy to get it, and we're communicating with them as much as we can. So is there questions on the vaccine before I move on to the other things? Like I said, we have vaccinated 150 so far with the 250 we have. We're finishing that up this week and expected to have 300 doses today, and with the guidance coming with that of where we can move to.
This is Commissioner Dickinson. One more question. So our guidance is from the state, obviously, because there are other states who are already vaccinating people over 65 and even on a first come, first serve without having to be 65. So their guidance is different than ours.
Well, I was saying, and I think, like I said, I'm struggling to hear you very bad with the way you're echoing. But With
Did you
with the
understand my question?
there, now I can hear you. Will you ask again?
Yes, I said, there are other states that are obviously, already vaccinating people over 65. So our, comes from the state and not from, so they have different, guidance than we do?
Every state has their own guidance. The federal government's pushing down theirs, and as we well know, the state can do what they want to do when it gets to them. And the health departments can only get the doses from the state. And that's where the Health Partnership Clinic came in, because like I said, they're regulated by the federal government. So there's so many different things we got to follow. And I don't think I finished when I was talking about giving the doses back. On the phone with one of the superintendents today, I found out that Western Kansas Health Department has extra doses, and they just started calling people and giving them. And it's just, there's really no reason for why their stuff's going. If they would have followed the stuff, sent it back, we might be ahead of the game, because then we'd have had it distributed the way we need to and then be rolling into the 65. But it's, the regulations and the way this is being distributed is probably the most frustrating thing I've dealt with in this pandemic. Testing has been a nightmare for a while, but quarantine orders have been a nightmare. But the distribution of this vaccine is, we're sitting here with plenty of nurses, plenty of staff to distribute it, and seeing this, what you're saying, Missouri said that they're doing some things different than us, and you see it on the news. It's just, we have to follow what Governor Kelly's plan is, and that's where we're at. So I'm hoping that we get some clear guidance. I'm hoping that this 300 doses has the stuff we need to really start getting this in some people's arms in the public, because that's where I want to be right now.
Nick, this is Don. I don't want to confuse things. I know it's terribly confusing for everybody. But on the X300, are you gonna go off your list of people that called in and determine which is the most needy or qualify, or how will you do that?
For the initial part of this, we're going to work through the list, and on the list we have tiered people in the phases. So when you call in, the questions are your age, number one, and then what health conditions you have, like diabetes, heart problems, anything like that. So basically, is what my plan to do is to take this list and just start working our way through it. If you're in what is considered Tier 2 and the 65 and over with the contributing or medical conditions, we're going to start with that. And that's why we have pushed this list so hard, is if we get a phone call from the state and they say, how many people do you have that will take this? I can say solidly right now, I have 1,800 people that will take it if you'll send it to me. So the biggest encouragement I can have for our citizens is, if you want on this list, call and get on it, because that's how we're going to hopefully have some pressure with the state. My COVID response, Derek has talked to our group, and Alan and Tom are on the state meetings every day, and they're lobbying pretty hard to get these doses for us. We're showing that we have the setup to do it. And I think, honestly, right now, that's what we can do. We've got Alan, who's well-known in the state on the emergency management stuff, and us working hard with KDHE, so hopefully we will get those doses. And that's, I feel like I'm giving no answers, but I'm giving you exactly what I know and what we're trying to do.
Yeah, you did fine. Thank you.
I hope next week I will have a whole lot more report, because I'll be able to tell you how we rolled out these 300 and really give you a good insight of how the pavement's going to start laying on the rest of the doses. So one thing that I do want to kind of jump into, because I did have a concerned citizen give me a call, and I want to empower you guys, if you have those, to kind of understand the testing situation. As you know, we have Well Health in our community. One of them's at Pomona, and one of them's at Neosho County Community College. These are state-funded testing locations. They are also not doing the nasal swab like we are. And you know, some people that's appealing, but I want to walk through some numbers with you, and I want to talk about what, you know, I think we're lucky to have them. I think the more people we can test, the better off we are. But if these are just drive-through things, they're not giving quarantine orders. They're giving guidance. There's an app, and if people read the app, it says if you have symptoms, don't go out in public. Don't go work at somebody's business. If you feel you need to get tested because of symptomatic reasons or contacts, you should follow the orders. And they have that, but they're not giving them a piece of paper that says quarantine. And honestly, some of this falls back on the integrity of the individuals and what they're getting tested for. And we can't police that. The good thing is we can find out the number of positives, and it gives people the assurance, whether they have it or not, they've been exposed, but they do need to follow the rules that's been put out there in multiple different places. And we have had individuals that got tested, went and done things, went to work, and the turnaround time for this is upward to 4 days. So in that 4 days, they can contaminate a lot of people if they have symptoms. So just because they're not giving out a piece of paper that says you're quarantined, people need to do the right thing. And the individual I talked to yesterday was pretty irate because they didn't give something out, and we have no control over that. It is a state-funded testing. It gives us an opportunity. I will tell you, we've seen a lot of people from Osage. We've seen people from Coffee. We've seen people from Anderson, Douglas, come into our community to get tested, and it's nice that we can kind of be organized enough that the state looks at that and brings them here. But there is going to be shortfalls. So just to give you a heads up, Pomona has tested 286 people. 218 are negative, 28 positive. The biggest concerning number I have are 22 of those samples have been rejected. I will tell you, doing nasopharyngeal swabs, throughout the last 10 months, we haven't had 22 rejected. And if we have, it's been because of the vials we received from the state that leaked on the way up there. So that's a large percentage from 286 and 22 of them being rejected. And those are people that waited 4 days to get the test to find out that they were rejected. So that number is very concerning to me. And then they have 18 pending. You look at the Ottawa location, since they've been here, they've tested 489 individuals. 334 of those are negative. 71 are positive. They've only had 9 rejected samples, but they have 75 samples pending. So with us, we're working through the state still, and we still have the opportunity to use MAUDE, which honestly has been an amazing partnership because they text out or email out the results, and normally working with OPD transporting those for us up to the city, we're getting results well within 24 hours. And you know, that could change on a daily basis, but we have seen 1 rejected sample since we've been with MAUDE. And that's all we've seen. So there is a big difference between the saliva testing and the nasal swabbing that we're doing. I know it's not the most comfortable, but there is a better percentage of them not having rejected samples and stuff like that. One of the things that we're working through right now, I got a phone call from Ottawa University. Ottawa University is now with the league that they're in is wanting to test all track members once a week. So we're going to be working closely with them, trying to figure out a good way to test all of their individuals on track once a week. So we have a lot of moving parts on the testing. I still strongly encourage people to get tested, but I also want to make sure to say that if you feel that you have symptoms of COVID and you get tested, please wait until you get your results back before you move forward. We have people calling us, wanting us to give them the results from these testing sites in Pomona and Ottawa, and we can't. We won't get those results until they put them in the system. I do have access to them, But what I just gave you is what I can see too, and they only get updated once a day, and so people are going to get their results before I do, and that's one of the things that we're dealing with. So if you have any questions, I'm happy to answer them, but I'm hopeful when it comes to vaccine, the 300 will lead us into starting to get our general public vaccinated, and the state's going to start giving us some better guidance now that we've got all of our nursing facilities vaccinated or scheduled. I will tell you, Rock Creek has gotten theirs, Richmond's gotten theirs, Wellsville's at the middle of the month to get theirs. Vintage Park is on the list to get theirs, and one of the things that was encouraging about that in the conversation yesterday is the majority of all the residents have chosen to do that. I think that like Rock Creek, there were maybe 4 that didn't. Richmond, there was 2 or 3 that didn't. There was 2 or 3 at Vintage Park. So the majority of these critical population individuals are getting the vaccine, and that's encouraging. So I'll close with that unless you have questions.
All right. Doesn't look like it. Thank you, Nick. Let's go to Sheriff Richards.
Yeah, good morning, Commissioners. Really the updates that I have. Monday, we were sworn in to start our new terms. And also on Monday, I was reappointed to the State Human Trafficking Advisory Board by Attorney General Schmidt. I've had the privilege of serving on that board for a few years, and so I look forward to serving another 2-year term on that. Also, yesterday, our command staff, we had a retreat for command staff to go over kind of where we've been in 2020 and then kind of help develop our plan and kind of tweak our comprehensive plan moving forward. And we had a good meeting. So that you all are aware, we did use the conference room out at the New Holiday Inn, I understand part of the agreement was that that would be available to us, and they were very accommodating. It's a nice setting out there, and it benefited us to be out of our office with no phones and people not interrupting while we were doing our meetings. So that went well. And then also we're doing what we can to stay on top of any intelligence information that comes out and what the climate is. I know that there are concerns from the public because we've had several calls about civil unrest leading up to the inauguration and next week. I want to assure the board as well as the public that we are discussing those things. We're reaching out to all of our contacts, and I don't believe we will be caught off guard. We have plans in place and are taking some steps there. So, but if anybody hears anything specific, please call and we'll talk to you and listen to what it is you have to say. And it may or may not be something we've already heard or already know, but I'd rather hear it twice than not hear it at all. So that's really all I have on that, unless any of you have questions for me.
Doesn't look like it. Appreciate the update.
Thank you.
David Lee, Public Works.
Okay, so road and bridge crews have been busy hauling rock, and we've had to repair multiple locations around the county that were negatively impacted by the snow and rain over the weekend before last. Our folks have managed to make quite a few improvements despite the fact that we're down 3 motor graders right now. We've had just a glut of odd equipment issues that have put them down. We should have one back up and running today, and Foley Equipment is bringing a loaner down to us, should be here already, free of charge. That'll help us get back to full strength. We've also pressed into action our spare grader, which is a 30-year-old John Deere. It's a little bit smaller than the blades that we use now, which could cause issues, but we really need to take advantage of this decent weather that we're having to get our roads reshaped. Additionally, crews have installed an entrance at 1824 Nevada and began a ditching project on Nebraska Drive west of Nevada, north of Ottawa. And then we're starting another ditching project up around Wellsville on Utah, south of Stafford. We're doing that today. And then we've also spent a couple of days picking up trash that's been dumped along the road, well, on the road and in the ditches around the county. I will say that the folks that we did the work for on the Nevada entrance called me yesterday after the work was complete and were very complimentary of the guys and the work that they did. They thought that the work was perfect and that the guys were quick and efficient and did a wonderful job. So it's always nice to get positive feedback. And I'll finish up with letting you know that the landfill expansion feasibility study that SCS engineers or consultants is working on, they are close to being finished with that. And we'll be presenting to you all probably at a study session sometime late January, early February. They'll present the evaluation and they'll discuss the permitting process that we hope to kick off later this year. So that's all I have, and be open to any questions you may have.
David, this is Don.
Yes, sir.
I was south of Rantoul on Hamilton Road, and the guys are doing a good job down there. I know that's a low traffic road, but it is a main road. And I went through there the other day, and they've really got that shaped up and rocked really good.
Good.
All right. Well, thank you, David.
Thank you.
Janet?
I don't have anything today, thank you.
All right. Commissioners' comments and board reports. Don?
Nah, nothing. I just appreciate everybody doing the solid waste management plan. I know it was a little late, but Shay has been doing this, and our coordinator, and she hadn't even been able to face one of us for almost a year since she's been hired. So I think she did an outstanding job under the circumstances. She's having to do everything by internet and over the phone and emails, and that's a darn hard thing to do with a project like this. So I just thank everybody for signing off on that today. That's all I have.
All right. Roy?
Yeah, I wanted to get back to what Derek was talking about, as far as our employees and bonuses and things. I think there's a lot of people could be included if we wanted to do that, but I think Derek had a good explanation of that. And if we provide all the PPE that people need, I think that's very important. I know, everybody's worked extra for the county to keep all the county services going. And as a commissioner, I appreciate everybody that has done this. I know a lot of people have been working very hard this last year to try to get us through this, and there's still hard work to come, and I just appreciate everything that the employees of Franklin County are doing for us. Other than that, I don't have anything.
All right. Rod?
Yeah, I don't have anything to add, Cole.
All right. Ian?
This is Commissioner Dickinson. On Thursday, I finished up my part of the Employee Service Awards with JDC and the county attorney. When I first met the county attorney officially as a county commissioner, I made a comment to him that I never wanted to have a photo op with him. Well, there is now a picture of me presenting his service award to him. To his credit, he did stoop a little to make it a little bit better, but do appreciate our employees. I had forgotten to mention that during our Employee Service Awards, I had a conversation with Jamie Wilson, our county appraiser, about our county values, and that was one of the things that we were concerned about as we went into COVID. And he said, he kind of chuckled and went, not only did our values stay the same, but they also increased possibly up as much as 10%, which is incredible, I think, in this day of the COVID. So, I think a lot of things are surprising. Our county sales tax not only remained steady, but increased. County values increased. So, as far as being a government leader and working on trying to budget, our finances are in good shape. On Friday, I listened to the governor's biweekly COVID-19 conference call with the legislative and local elected officials. It was all about COVID. She talked a lot about her phases and how that she was looking to hopefully be to phase 2 within maybe a matter of days. And then also the fact that if you watch national news at all, Kansas has definitely been on the very bottom of the list as far as the COVID vaccine rate and getting out there. And they are trying to convince us that it's not really that we are on the bottom, but it's reporting. But definitely Kansas has can do better, I think, as far as getting those. Actually, I actually sent emails to our congressman, just saying, guys, let's get to work. That the Kansas needs to have somebody there leading and being advocates for the state of Kansas and help us get those doses that we need. The Ottawa City Commission on Monday met for their study session. They had been for several weeks discussing residency requirements for especially their department heads. As they are working on hiring a new finance director, they're finding it a little bit difficult to find some qualified people that are living in the city of Ottawa, and they are looking to possibly make some changes in those requirements. They're still discussing it, and we'll be bringing it to the regular session. They have elected their new mayor of Sarah Kaler and their new mayor pro tem, Eric Crowley. They also introduced their new city clerk, Melissa Reed, who takes office on February 1st. And they are also looking to maybe possibly refinancing some debt as long as the rates don't inch back up. But that's something that they are considering, and that is my report. Thank you.
All right, I don't have anything that I need to add. So with that, before we look to adjourn, anything, Derek?
No, sir.
All right, any of the commissioners, anything you want to add before we look to adjourn? All right, then, I need a motion to adjourn.
So move.
I need a second.
Sure done. Second.
All right, all in favor say aye.
Aye.
All right.
All right.
We are adjourned. Thank you.